Welcome. I'm so excited to share this wonderful interview with you with Dr. Elisa Yao. If you're new here, I'm Rita Johnson, owner of Divine Mercy Nutritional Care, and I help women to take their health back into their own hands by taking a functional medicine approach to diet, lifestyle, and mindset changes. Welcome.
Welcome, everybody. Thank you so much for joining us today as I have an opportunity to interview the amazing Dr. Elisa Yao. I want to start off by introducing her to those of you that don't know her. Dr. Elisa Yao is passionate about helping couples get pregnant naturally by finding and treating the root causes of fertility struggles. She has a holistic fertility telemedicine clinic in California. In her clinic, she uses her unique blend of training from functional medicine, fem medical management, NAPRO technology, and neofertility to provide her patients with personalized treatments that help improve couples' preconception health and feeling of well-being. Dr. Yao graduated from UC Berkeley with Phi Beta Kappa honors, majoring in molecular cell biology, and completed her medical training at UC Davis School of Medicine. She's now a mother of two and having overcome infertility despite advanced maternal age. Thank you so much, Dr. Yao, for joining us. Welcome.
Thank you. It's a pleasure to be here.
I am so thrilled that this has worked out. Dr. Yao and I go way back. We had a wonderful chance encounter meeting years ago at a NAPRO fertility conference. And I just feel like that was a total godsend to bring Dr. Yao into my life. So I'm so excited to share her with all of you as well. So as we get started here, Dr. Yao, if you don't mind just telling us a little bit more about you and what your practice looks like, or perhaps just your day-to-day life with doing all those many busy things with little ones in tow.
Oh gosh, where do I start? So, well, as you mentioned, I do have a holistic fertility telemedicine clinic. So I mainly see patients, well, I only see patients who live in California. So yeah, my day-to-day is, mainly seeing patients and juggling the tasks of motherhood, preparing breakfast, lunch, dinner. So kind of the usual stuff. So yeah, not too out of the ordinary, I would say. But
good, yes.
yeah,
Well,
I
and
think.
excuse me, go ahead.
But I think it really brings me a lot of joy to do what I get to do, working with the couples, helping people regain their health in addition to improving their fertility. So that it's in itself is a very rewarding process. Yeah.
Yeah, for sure. I know. I always say that there's no better day to be had than when you find out somebody that's been struggling to conceive tells us they're pregnant, right?
Exactly. Yeah.
It is the best work. I love that. So just to start off, I would love to hear from you. How is functional medicine different from conventional medicine?
Yeah, so functional medicine is about addressing the root causes of health issues, and you would think that conventional, typical Western medicine should address root causes, but in reality, that is not really the case. And I think it helps by giving a more concrete example to illustrate my point. So, in women's health, say a woman has painful period, and she goes to see her OB about this. Chances are the woman's going to be prescribed either NSAID, a nonsteroidal or anti-inflammatory drug like ibuprofen, Motrin, Aleve, something like that. That's basically a painkiller, or they'll be put on birth control pills. But neither of these are really addressing the root causes of why the woman is having painful periods to begin with. So the NSAIDs, those pain medications, they can cover up the pain. But if it were to stop taking the pain medication, the pain would just come right back, right? And same thing with the birth control pills. That basically knock out the normal functioning of a woman's ovary. But once a woman come off of the birth control pill, like when she's wanting to start a family, then the pain come right back just the same. So the root causes of the painful period was never addressed. So whereas the functional medicine approach is, hey, let's kind of dig in a little bit deeper and find out what is contributing to the painful periods. So through my training and my experience, I found that, with painful periods, they're frequently due to mineral deficiency, like magnesium deficiency, due to inflammation, estrogen dominance, or some combination of those three. And so my first step is to actually first test to assess for these three potential causes. And, once I treat the issues I have found, oftentimes I see that painful periods are reduced dramatically, if not completely resolved. And so that's a more concrete example of how the functional medicine approach is very different from the conventional approach. Yeah.
Yeah. So if somebody was interested in functional medicine, but truly didn't know where to start or couldn't afford it, are there any things that you would say to them to try to do to dive deeper into their own health issues, whether perhaps with the help of their conventional doctor or perhaps by taking things into their own hands?
Yeah, like I said, as a medical doctor myself, I was not trained in any of the functional medicine during my medical school. So I think most doctors are not quite familiar with functional medicine. So yes, I think it's helpful to do a little bit more research now with internet. There's a lot of info that you can find online. Um, I think you first asked, there are a couple questions there. What was the first one again?
Yeah,
Um,
so what would you recommend to someone that feels like, and probably they don't live in California, and
Yeah,
so they
right.
feel like conventional medicine's their only option, because they can't find a functional medicine doctor, or perhaps they can't afford it.
Yes, yes, yes. So, I think if you just go to Google and Google functional medicine practitioner, you could find that people that way. There
Yeah.
are various directories, Institute of Functional Medicine, ifm.org, I believe. They also have a directory, but not all functional medicine practitioners are listed in that directory. So there is also the A4M. It used to stand for uh, American Academy of Anti-Aging Medicine, and they teach various practitioners about functional medicine. So I believe they also have a directory. But I think simply Googling uh, for a functional medicine practitioner local to you can be helpful.
Yeah.
Yeah,
Yeah, and it's so nice too in this post-COVID world, if we can say that, that there are so many more options with telemedicine. It's such a gift.
absolutely. Yeah.
So, what are the things that you see most commonly in your functional medicine practice when someone comes to you with infertility? What are things that you're automatically testing for or thinking in the back of your mind? These might be things we need to kind of rule out first and foremost.
Yeah, so when it comes to getting pregnant naturally, egg quality is really important. Because if a woman doesn't have optimal egg quality, she's more likely to have miscarriages. And some of these pregnancy loss can happen so early that the woman may not even realize she was pregnant in the first place. And to optimize egg quality, you really got to have optimal hormonal balance, and you got to have a good mitochondrial function. Now, unfortunately, there's no direct test you could do to assess egg quality. So I do a whole host of tests to assess for hormonal balance. And also I test for markers of inflammation, oxidative stress, to assess for mitochondrial health, because mitochondria is very susceptible to inflammation and oxidants. And so, yeah, so what I have found in my clinic is that a lot of people have hormonal imbalance. So hormones, I'm talking about like prolactin, androgens like testosterone, DHEA. Sometimes it can be too much, sometimes it can be too little. And so my job is working on bringing them back to balance. So yeah, so hormonal imbalance is something that is pretty big that I see in my practice.
Okay, so interesting. So if someone was having thyroid issues, can that be correlating with infertility? So if they came to us and said, "Oh, I'm having infertility and I have this random thyroid thing. It's managed, but that's there." Would you say that that could be another reason contributing to infertility?
Yeah, it certainly can. Ideally, I think even the conventional endocrinologists, those doctors who specializes in hormones, would say pre-conception, you want your TSH or thyroid stimulating hormone to be less than 2.5. And I think in the functional medicine world, I think it might be even better if the TSH is less than 2, So you do want to optimize your thyroid. Thyroid is important for our metabolism, helping us with energy. And, metabolism is also very important for having the egg cell being able to grow properly. And that is important for egg quality. So certainly, yeah, there's plenty of research without a doubt. Thyroid health is very important for fertility. Yeah.
So, are there some things that we can do to support our thyroid health on the individual level? And perhaps how is that different in functional medicine versus conventional medicine? Maybe we could start there.
Yeah, so thyroid health, so there are some basic nutrients that a thyroid need. So, things like selenium, and a little bit of vitamin A. So, eating a little bit of Brazil nut that has more selenium can be potentially helpful. Um, and then, doing things that are also, uh, this is actually really big, and a lot of people do not appreciate the connection between stress and thyroid. So when people are more stressed, that definitely has an effect on the thyroid. So I know it sounds maybe a little mundane, but it is really important to address our stress and being better able to manage it. It's not practical to get rid of our stressors in our modern day life, but certainly having a better mindset about it is very important. So stress management can be hugely helpful. And also keeping in mind that there are certain environmental toxins that can be not so good for our thyroid health. So paying attention to what we have in our environment, using cleaner products can be helpful too. Yeah.
Okay, so helpful. So what about low progesterone? You and I both having met at a NAPRO technology conference, it's very common once we start getting down this road of looking at hormones along with timing the cycle to just support progesterone with the bioidentical medication. But are there other things we can do also to help support that progesterone level?
Yeah, great question. So, why I think it's good to first talk about why do we care about progesterone. So, progesterone has many functions. One, it can help a woman feel more grounded, more calm. So frequently, premenstrual syndrome with the mood swings is actually related to progesterone deficiency. And now, when it comes to fertility, progesterone is also very important because it prepares a uterine lining for implantation of the recently created embryo. Progesterone is also very important for maintaining pregnancy by inhibiting the uterine contraction. So, low progesterone can result in miscarriage or even premature labor and delivery. Now, we also want to keep in mind that progesterone is mainly made after ovulation has occurred. So, the root cause approach to improving low progesterone levels to improve the quality of ovulation. So, that's probably something that most women have not even heard of, the quality of ovulation. So, yeah, oftentimes women say, yeah, I ovulate every month, but the main question really is, what is the quality of that ovulation? And when woman presents with lower progesterone level, to me, that means also lower quality of ovulation. And the quality of ovulation has a lot to do with egg quality, which we kind of talked a little bit about earlier, which we said it has a lot to do with hormonal balance and also with mitochondrial health. And so to improve progesterone level, we want to have optimal hormones and healthy mitochondria. So we talked about how, like with mitochondria, it's susceptible to inflammation. So doing things like eating an anti-inflammatory diet can be helpful. So cutting down on the sugar. Mitochondria really does not like environmental toxins like BPA, bisphenol A, that we see in plastic. So avoiding that can be helpful. Now, on the hormone side of things, I have seen how like women who have low energy level, have feeling more stressed out. And sometimes actually women may not appreciate how much stress that they're under, and they have low DHEA levels. And that has definitely a negative impact on egg quality and the quality of ovulation. And so when we improve the supplement like with DHEA based on the blood test that we see, then we can see that she's now having maybe a longer post peak period, because now her progesterone levels are better. So the hormones like prolactin, I frequently see that being more elevated than optimal. And that reminds me that, a lot of labs, they have a really wide reference range for prolactin. Some would say that even like up to 25 is normal.
Wow.
Whereas for me, I like prolactin to be well below 14 for optimal ovulation. And so, prolactin can be increased due to stress. So doing stress management can be helpful. In terms of things women can do on their own, there are things like Vitex, that's an herb that you can get over the counter that can potentially help lower prolactin level. But there's so many different supplements out there. You do want to make sure you pick the higher quality type. So yeah.
Yeah, for sure. That's so good. So going into a little bit of really this kind of goes into your own journey. But, a lot of times we'll hear women that went to their doctor, maybe they're 35 plus, and they're told, oh, you have low AMH. You have very little chance of getting pregnant at all. Let's try IVF as soon as possible, right? There's this high pressure, high stress time, and they're told like, this is it. You're running out of time, right? What would you say to someone going through that?
Yeah, so I tell people, in a big picture sense, like from your 20s to your 50s, it is true that the AMH in the overall scheme of things is going down. But the reality is that, yes, you can actually improve your AMH. I have seen it in my practice.
Wow.
And also, AMH is not the end all be all when it comes to getting pregnant naturally. So AMH is certainly a very important biomarker when you're going for IVF, because IVF is a process where, you're trying to, it's a numbers game, basically. You're trying to maximize the number of follicles, eggs being matured per cycle. So they're trying to get at least, 15 eggs matured when usually you only mature one egg per cycle. And of those 15, then, that they retrieve, then they mix it with the sperm and maybe only 10 fertilize. And from those fertilized, only maybe 5 make it to like day 3. And maybe of those, only a certain fraction of that is of a high quality enough grade that they're willing to put back into the woman. So if you don't have enough egg reserve in the first place, you're not going to be able to retrieve that many eggs. Then you're not going to have a good outcome. Maybe, you only retrieve like 3 or 4 eggs to begin with. And by the time you go through all that process, you may not even have any embryo left to put into the woman's body. So, egg reserve is definitely very important when it comes to IVF. But for couples who are wanting to get pregnant naturally, you just need to mature 1 egg per cycle. And if you're ovulating, you are maturing 1 egg. So really it's about making sure that maturation process is as healthy as possible. And that's what contributes to egg quality. And so I kind of take a different approach in my practice. When couples come to my practice, I say, it takes 3 to 4 months to improve egg quality. It takes at least 3 months to improve sperm quality as well. So let's do a proper workup and let's do things that actually work on improving your egg and sperm quality. And once you have done that, then actively try to conceive, because otherwise, if we're not addressing the root causes, again going back to functional medicine, then what's going to prevent them from maybe having another miscarriage, or just not having success. So I try to help prep couples for their highest chance of successful pregnancy by optimizing these underlying issues. And I remind them, by doing these things, you're basically reversing ovarian age, and you're helping your sperm quality be healthier too. So that's going to go a long ways in the long run. Yeah.
That's beautiful and so hopeful. And it also feels like I can just hear someone receiving those words from you and just breathe deep, maybe for the first time in a long time, because it does tend to, when we're told we need to hurry, we're running out of time, we're running out of eggs, it just tends to cause this spiral of stress buildup. And it's so the opposite from what you're saying of everything we need to focus on to really optimize fertility and our sex hormones and all of that, right?
Yeah, absolutely. Yeah. Actually, another thing to consider when people have low AMH that the conventional medicine doesn't really talk about is that I kind of see that low AMH could be a sign of an underlying autoimmune process. And the conventional medicine approach they don't really do a very good job with addressing autoimmune process. Even like when we're talking about things like rheumatoid arthritis, they're usually using big gun medications to suppress our immune system. Mm-hmm. But with functional medicine, we talk about how to, improve our optimize our immune system. So again, it has to go to the diet, looking at the gut. The gut is kind of the source of autoimmune processes. So, that's so that's kind of fundamental, and those sort of things that I would address with my patients too. But certainly starting with diet, something that you can control, can be helpful, can be very helpful. Yeah.
That's beautiful. So piggybacking on that, what part would you say that gut health has to play in fertility?
Oh gosh, so much. I mean, there's so many aspects of it. Like, some women, their bacteria may be overproducing an enzyme called beta glucuronidase, and that can cause them to recycle excess it can cause them to recycle their toxins in their body. So, and even estrogen, and that can contribute to estrogen dominance, for instance. So, so that's one part of it. But, even like bugs like H. pylori, Helicobacter pylori, there are studies to show that it can contribute to autoimmune process through something called molecular mimicry, because when our bodies develop antibodies to this bacteria, it looks very much like our thyroid. So you end up attacking your thyroid instead. So there's a connection between Hashimoto's and H. pylori. So, if we do a functional medicine stool test, you might be able to see that. And then, there's ways to treat the H. pylori. So that's another way. Or just seeing, if there is inflammation in the gut, that can certainly contribute to inflammation in the body overall. So there are just multiple ways, but certainly the autoimmune issue that I related to earlier, if people have more of a leaky gut where things are getting in more so than they should, that certainly is going to incite an autoimmune process. Healing the leaky gut can be very, very important. And what contribute to leaky gut can include things like taking the NSAIDs that we mentioned earlier, like the ibuprofen. They can actually cause that. But also birth control pills can potentially cause leaky gut. And food sensitivities like gluten, dairy, they are huge sources of leaky gut in this country. So, yeah.
So fascinating. So with your own experience of having had your babies with advanced maternal age, what what words of hope would you like to leave our listeners that are on their own journey of infertility and worried that time is running out?
Yeah, so, I had my first baby at 37 and I had my second baby at age 42. So I understand, I was definitely quote unquote advanced maternal age when I had my babies. But I think it's just so important to optimize your preconception health because taking the time to do so, I think goes a really long way to helping the health of your future baby as well. So, I feel very blessed that, having done the work to optimize my preconception health, to optimize my egg quality, I had healthy pregnancies for both of my babies, and both of my kids are fairly healthy too. So, I think, yeah, take heart that it is possible to improve fertility. And by taking a functional medicine approach, you can actually set yourself up for healthier pregnancies and healthier future babies.
Oh my goodness, I love that so much. Thank you so much, Dr. Yao. Can you share with my listeners where they can find you?
Yeah, so my clinic website is just simply my name, Elisa Yao, MD.com, ELISAYAOMD.com. I do have some blogs on my website, some resources that people can check out. So, yeah.
That's wonderful. Thank you so much. And I will also toot Dr. Yao's horn that if you Google her name, you'll find lots of interviews she's done, whether it's like similar to this on YouTube or different talks she's given at other unexplained infertility summits, those kinds of things. I feel like you've been on so many different ones, and you just offer so much beautiful quality content. So I'll link up in the description to this video more ways to find and follow Dr. Yao. And of course, if you're in California, I highly recommend her program. It is so wonderful and robust. She just does so much for these couples. It's beautiful to see.
Thank you.
Yes, well, thank you so much for your time today. I really appreciate it. And I hope you have a great day.
You too.
Thanks.
If you enjoyed this video, please like and subscribe for more content from me. And let me know in the comments what you would like to hear more about, questions you have, or what types of providers you'd like to have me bring on to the show. Thank you so much for watching.